Back pain affects millions of Americans. For some, the pain becomes severe and can disrupt normal daily activities. One of those is William Langley.
Initially, I went through just physical therapy for a period of time. That helped for a short period of time again, but certainly didn't cure the pain. The pain would return. Then we went through another series of spinal injections, steroidal type injections. Pain would return and would get more intense to the point that it was hard to do daily things.
William suffered from degenerative disc disease. What that means is that the small round discs that actually sit between each of our vertebrae and function as shock absorbers, allowing us to bend, twist, and flex our spine, can over time become thinner, and then they can become injured. And when that occurs, it creates pressure on the adjacent spinal nerves, and that can lead to intense pain, which is worse when you're sitting, lifting, bending, or even twisting. Degenerative disc disease is most common in people in their 30s, 40s, and even 50s. For Langley, just going to work was a real struggle, and enjoying recreational activities was almost out of the question.
Well, we didn't travel at all. Actually, our vacations, when normally we travel out of the country at least once a year. On vacation, we did not get to go this last year because of the pain involved. We made some short trips, but even at that, I was in pain.
He was at the point where this was impacting all of his major activities.
Doctors determined that Langley was a good candidate for back surgery.
He had back pain. We were able to identify the cause.
The surgery would be a difficult one, involving removal of 2 discs in the low back and inserting a special cage in their place to maintain the height and stability of the spine until the bone could fuse across the gap. The surgery would also involve applications of some exciting new research developed in part at Emory. This and additional pioneering research, headed up by Dr. Louisa Titus and Dr. Scott Bowden, is part of what makes this hospital unique. The research has been essential in helping the development of a bone growth factor known as BMP and an improved understanding of how these bone growth factors actually work in the body.
Several years ago in our laboratory, we discovered a gene that works in the cells, but a molecule, okay, which can induce bone formation. So we continue to work on that.
Louisa, what would this mean to the average patient?
Has the potential, I can't say for sure, to be applied in a number of different kinds of situations in which we need, bone growth or healing or formation.
Even with the cutting-edge research, for William, one consideration was what would happen after the surgery.
We talked about, the long recovery period that it would take, about 9 months for total recovery, that I would be wearing this brace for a long period of time also. And he really encouraged me to think about it.
Choosing the right doctor, hospital, and team was crucial for Langley.
But what has impressed me more than anything, I think, is the involvement with the patient. I think from day one, they spent the time with me. I didn't ever feel rushed. The technology they use, even in the front office when you go visit Dr. Bowden, he literally gives you a small electronic, almost a laptop, that allows you to go in and describe in very great detail where you currently are with your condition. When you're in that much pain and a procedure is that important to your walking in your everyday life, and you turn that over to somebody else and you trust them, it's a little bit scary.
After careful consideration, William decided surgery was the best option, not only to end his pain, but for a return to a normal life.
The surgery was really to take out 2 badly diseased discs and replace them with some metal cages using the bone growth factor, which meant we didn't have to make another incision and borrow bone from his hip, and it meant that the likelihood of it healing was 98% or better.
The surgery, called anterior lumbar interbody fusion, went smoothly.
Week after the surgery I was stiff. The pain I had initially felt from the injury was gone. Actually, the day I woke up out of anesthesia, the pain in my back that I had been feeling was gone. The numbness in my left leg and my foot was gone.
Essentially, almost all of his back pain that he had before surgery was gone, and he had some incisional pain, but that he already felt like a different person.
Langley's surgery was successful, perhaps as much due to the skill of the surgical team and to their depth of research and knowledge of the human bone.
Bone constantly regenerates itself. Bone it's one of the fascinating things about bone as a tissue. We think of it as static. We think of it as unchanging. Nothing could be further, from the truth. Bone is constantly being resorbed or taken away and constantly being laid down.
Currently, the bone growth factor protein is used to substitute for bone chips, which the surgeon would acquire from a patient's hip. It can be painful to extract the portions of the bone from the hip, and the recovery can be complicated. The use of bone growth factor means that for people like William Langley, surgery and healing will be much easier.
Man, it's been a great experience. And people have asked me, would you do this again in a heartbeat?
Still ahead on Atlanta's high-tech hospital, a different kind of caring.
The patient care there was unbelievable.
How the team approach adds something extra to the latest advances in medical treatment when we return to Atlanta's high-tech hospital.